Hello everyone, my name is Matthew. I'm a Health Science 160 consultant, and I'm the presenter for today's proposal called Bolivia's Health Initiative Plan. Bolivia, the plurinational state, is a lower middle income country located in central western South America, in the region of Latin America and Caribbean. Compared to the rest of the region, Bolivia is doing worse in many health indicators, from life expectancy to mortality rates. Data shown here from the World Bank shows the disparity between Bolivia and the regional average. If we are to look at the strides made by Bolivia in overall health, we can look no further than the progression of all-cause mortality. Here we have the all-cause mortality, the top 10 causes of death in Bolivia in the 2000s, and we also have the data on 2019. Looking at these side by side, we can see a clear shift from communicable diseases to non-communicable diseases, which shows us that Bolivia is now more prepared in managing communicable diseases, as well as treating them. For today, I would like to focus on three main health topics that we would like to view and recommend for action, and that is sanitation, health education, and malnutrition. Sanitation involves not only basic sanitation services like hand washing, but also includes toilets, latrines, sewer systems, and the safe management of those systems and services. In 2015, only around 43% of the rural population had access to improved sanitation. Improved sanitation has many benefits, including the reducing risk of diarrheal diseases, reducing the spread of parasites, and can even potentially mitigate scarcity of water, especially in areas affected by climate change. This is important because in Bolivia has been subjected to frequent natural disasters such as floods, landslides, droughts, snowstorms, and even hurricane-force winds. It is calculated that for every $1 invested in sanitation, there was a return of $5.50 US dollars in lower healthcare costs, more productivity, and fewer premature deaths. This makes investing in sanitation a clear choice to improve overall health, especially in the rural population. By taking a more upstream approach, we can minimize the strain on the healthcare system and possibly reallocate funding to areas of need. Moving on to health education. Health education can include healthy hygiene practices, early detection of illness, self-care, and even sexual health. Health education is important because it can enable people to play an active role in improving their own health, engage with community action for health, and understand health risks and benefits. Improving the health literacy of most of the vulnerable population can accelerate progress in reducing inequalities in health, as well as addressing and preventing some of the root causes of ill health, and not just focusing on treatment. Some key interventions that we would like to recommend are on women's health. Women's health education should be on family planning, promoting safer sexual practices, measures to reduce intimate partner violence, and enhance their ability to deal with unsafe abortions. In this way, this is also another way that we can reduce healthcare costs and also reduce and minimize the stress on the healthcare system. Lastly, we have malnutrition. There are various forms of malnutrition, but the focus will be on undernutrition. Undernutrition makes children in particular, much more vulnerable to disease and death. It can also affect maternal health and neonatal conditions. The recommendation for investment or resource allocation should be towards aligning health systems to nutritional needs and providing universal coverage of essential nutrition interventions. Addressing the immediate concerns of malnutrition will help mitigate some of the outcomes of malnutrition, as well as attempt to strengthen infrastructure, industry, and employment while improving income distribution and poverty reduction. This concludes the proposal for the Bolivia Health Initiative Plan. There's obviously more that could be done to address health overall, but constraints of funding will become apparent. The hope is this proposal will influence decision makers on the possible options of action to address growing health concerns within Bolivia. Thank you so much.